Hi everyone, Dr. Nemechek here. I want to touch on just briefly how COVID triggers an immune response and how it typically goes away, and how sometimes that immune response can persist, and where that inflammation that's driving that immune response comes from, because it's that immune response that causes a lot of chronic symptoms in people. And then kind of how our protocol, our approach can help you if you're having some difficulty. And this came to mind because we had some parents of a child that was recovering. The child, we decided or guessed that maybe having some post-COVID leaky gut, and we had added glutamine to the child's regimen and did dramatically well. And the parents said they started thinking about it, and I forget what it was. It was maybe a year ago at some point. The whole family had COVID, and the parents just felt like they never fully recovered. They were just kind of tired and kind of just didn't feel well since then. And so I want to go over kind of what's going on there. So this first screen you see here is kind of when you get COVID from a medical, infectious, immunological standpoint. What do you see? So here you go. You get infected about a few days before your symptoms start. So here's symptoms, and you're already often before your symptoms you're shedding virus and you're infectious to other people. Now these are averages. Okay, within about a week or so you aren't infectious anymore, but the virus you're shedding it, and the virus can be detected in your bloodstream even out to 14 days. All right, or with a swab. And here it takes a little while for an immune response to develop, and this blue line we can show these inflammatory cytokines in the body. They start increasing, and then you get out here to roughly say a week or two, and your symptoms are gone and you've recovered. Okay, that's basically how most viral infections work. In this kind of process, we look at these different lines. Now, what's happening though, if you have chronic symptoms, you want to call it long COVID or long haulers, and there's a whole bunch of different acronyms they're using right now, but basically you get COVID and you have some persistent symptoms. So we get the same thing, infected, symptoms might start a few days later, and before you even have symptoms, you're going to be infectious. Now, at least a third of all patients won't even have symptoms. Okay, you don't necessarily have to have symptoms from the virus, meaning no fever, sore throat, cough, stuff like that. But let's say you do in this case. You get your symptoms, and here the virus sheds, goes away, virus is detected, that goes down, but the inflammatory line doesn't drop off and stop. That continues, and that inflammatory phase that's now chronic, it can lead to chronic symptoms. Or if you are asymptomatic while you're having COVID, typically it's around 1 or 2 months after, say you have COVID exposure and you think, oh, I didn't get it, but we know you have asymptomatic infection. Now, you won't at the time. You might start feeling and have some new problems like a month or two later, and it's actually from the original COVID. Okay, it's from this chronic inflammatory phase starting to affect you. Now, from a very practical level, when patients come here, my whole protocol is, when they come here with long COVID kind of symptoms, my whole protocol has really been directed at reducing inflammation to try to get the autonomic nervous system to recover, but it has worked quite well with these patients. And we have basically two phenomena we have to primarily deal with, and that is these bacterial overgrowth in the small intestine seems to be affecting all of them. These are adults I'm talking about, and most of them also have this separate form of leaky gut that requires a different treatment. Now, I put everybody on fish oil and olive oil because they are having this other inflammatory problem from the food supply. And so everybody gets that. And then we have to deal with the bacterial overgrowth, or what we call SIBO. Real quick review. stomach, flows into the small intestine, into the large intestine. These birds represent these bacteria live up here. Fish represent these bacteria here. And what's happening in most of the long COVID patients is they are developing SIBO, S-I-B-O, meaning small intestine bacterial overgrowth. It's also just called dysbiosis by a lot of researchers. It's called overgrowth. And this causes a massive degree of inflammatory stress, which can affect your nervous system, your muscles, all sorts of stuff. And this is called leaky gut. And so here is a graphic. Now, this line here are the cells, the barriers of your intestinal tract. So here in this section, this is normal. They're showing there's nothing getting through here, okay? No bacteria. Here's a bacteria. There aren't many up there. That's normal. That's supposed to represent kind of when you're like this. You don't have much bacteria at all. Now, when you get COVID, you're often developing these two different problems. One is excessive bacteria. That causes a leaky gut between the cells, all right? We call this paracellular intestinal permeability. Of course, medicine, we have all these long terms. That causes a lot of inflammatory stress. For that, in adults, you might try some inulin, prebiotic fiber, about a quarter teaspoon twice a day. And but what works better if you can get it is Xifaxan, or the generic form of that, rifaximin. And there you'll need it twice a day, often nonstop for about 4 months before you stop, and then it won't relapse very quickly. But in addition to this, in COVID, you have this different problem. Entire cells die. This is called apoptotic permeability, and this can be pretty bad. All right. Now here you have increased permeability. The phrase the researchers are using for this, hyperpermeability, implying a lot of stuff flowing through. Okay. So even though you get rid of those bacteria up there, you're left with these big holes, and it's due to a relative glutamine deficiency. It's just that you can make some glutamine in the body. Now, glutamine's an amino acid, but when you have inflammation, all the glutamine gets shuttled to the immune system, and it creates this deficiency, a relative deficiency in these enterocytes, and they'll start dying and not function right. And so you have to take oral glutamine. All right. Dose of that's about a level tablespoon twice a day. I have people do that for several months as well. And so what we're trying to do then is, if you can stop this chronic inflammation from those two major forms of leaky gut, your symptoms go away. If you've had neurological injury from it or whatnot, you can recover. It's fairly traumatic. And so in these parents, getting back, who had brought this up, where we had used the glutamine with their child, they had gotten 10 days of rifaximin. They'd taken that, they put themselves on the fish oil and olive oil, and they said, boy, once they added the glutamine, bingo, it was a big difference for them. So even if you don't think you've had COVID, there's a big chance you've been exposed to it, you were infected, and you have a 30% chance you wouldn't even know you were sick. The whole point is, if you're starting to feel tired or having some problem that's been going on for a while, you've seen your doc, you don't know what it is, your labs are okay, generally speaking, you need to consider this. And I think it can make a big difference for you. It's really simple to treat. All right, that's all for today, everybody. Take care. Bye.